So how do you treat adjustment disorders? So effective treatment for adjustment disorders will it's effective because it's going to result in you returning to a similar or sometimes even higher because of the treatment, a similar level of functioning or a higher level of functioning as you had before that big stressor hit your life. The most common treatment includes really either a combination of these two things or really just the first one. So, some type of cognitive behavioral therapy, also called CBT. And CBT is generally done, cognitive behavioral therapy is generally done individually or in groups. So it could be a group format, it could be individual talk therapy, and it is some kind of support group of some kind. And it involves really CBT is helping you recognize your negative or unhelpful thoughts. I like to think of them as unhelpful sometimes, right? And the subsequent feelings you have. Remember, you feel the way you think. So you got to identify those thoughts. Sometimes you identify the feeling first and you can work it back to the thought, or sometimes you can just identify the thought. And then you learn how to change the thoughts. Okay. And then you have to change the way you're thinking about something. So, that thing I always say a lot, life isn't happening to me, it's happening for me. You see the world, you're changing your perception of the thing and the event by shifting how you think about it. Instead of an obstacle, something is a challenge. What happens is what you're doing with that is that if you think of even just both those small things, those are pretty small, but those two small things, if you notice when you think of something as a challenge instead of an obstacle, the obstacle, your energy goes down. It feels like it's a huge thing. Do I have the energy for this? As opposed to a challenge, sort of even my voice changed, right? Bringing your energy up, how can I tackle this? You start to think of ways to tackle it. You start to think of problem solving, right? It really shifts how you approach something. It shifts your mood and your thoughts about how effective you can be. So if you want to try this yourself, if you, again, don't have access to therapy, or you just want to try, even if you do and you want to try this yourself, my very favorite tool is free for you, my friend. It's something called the RET tool. RET stands for Rational Emotive Therapy, which is CBT in another clothing, created by a man named Albert Ellis. Brilliant, brilliant. And I did an entire episode on RET, which I will link to in the podcast page and in the blog post page. So you can go back and listen to this. I think it's like the most effective tool you need or something, but you don't even have to go listen if you don't want. You can just download the RET tool and you'll see you got to write, it's a little thing, but basically you have a situation and you write that down, and then you write your beliefs or your thoughts about it. Then you write down your feelings, and then you dispute the beliefs. And really that's kind of asking yourself, what else could be true about that? And then as you think new things, you'll have new feelings and you'll take different actions. You'll see. And so you can go over and download that, and that, I'm sure on YouTube we'll have that easy for you to download also. It's the RET tool. And I still use this tool, and I've been using this tool for, I guess, 40 years, because I learned it, I think, 40 years ago. It's been that long. This is one of my favorites. I come back to it over and over for a way to change my mood very quickly, to help me feel more empowered quickly, to help me feel some hope, some problem solving, some way through. It's, think about it, a rational emotive therapy. It's using your rationality over your emotions. It's helping your brain think better when your emotions have taken control. And so come over and download that. And to be, me, I'm always transparent. When you download anything from me, you will be put on my weekly love letter. I don't even call this a mailing list, because that's not what it is. It's a weekly love letter, and that is all you will ever get. And the love letter is not, hey, buy this thing. The love letter is some inspirational story, and they're short, or I don't know, some research I read or something that I'm not including in the podcast for whatever reason, that is meant to help motivate you for the week. If you like the podcast, you will love the newsletter, is what I believe. But if you don't like it, you can just unsubscribe. It is so easy. I don't make it hard to unsubscribe. I make it very simple to unsubscribe. There's nothing here sleazy that I do. If you don't know me, I don't play that. but the RET tool I highly recommend if you're going through this. And then the other thing that's also used, I said there were two things. There's CBT and then there's medication to help alleviate current symptoms. And I will say that I don't like medication alone. I really think you should be doing talk therapy also of some kind, but some kind, of anti-anxiety. Usually it's anti-anxiety or sometimes an antidepressive medication. Again, depending on which type of adjustment disorder you have, is often used along with some kind of talk therapy to help alleviate symptoms so you can think more clearly and use your tools, right? And use your tools. So come download the tool. I want to also say, and I will list them, but if you're having suicidal thoughts, again, the risk of suicide can be higher in people who have adjustment disorders. So if you are thinking about suicide and you have a mental health provider, you should contact them right now. You should stop listening immediately and contact them. If they're not available or you don't currently have a provider, you need to contact an emergency number or hotline right away. And I will list the numbers in the US. There's a Spanish speaking hotline. There's a live chat. There's US veterans or service members who are in crisis can call the Veterans Crisis Line. Like, I will list all that in the show notes and on the blog post page, but just please, I love you. Don't sit with those feelings. Don't think, oh, they'll just go away. Even if they have before, they might not this time. And I cannot risk losing you. We cannot risk losing you. So please make sure that you follow up immediately.